The FDA has just approved the Blincyto in a new indication as consolidation treatment for patients with acute lymphoblastic leukemia. Let us dive more into the details of this approval and how it is significantly improving the survival of our patients. I am Fadi Haddad, hematologist and oncologist, and I will be reviewing today the recent approval by the Food and Drug Administration FDA on June 14 of Blincyto as consolidation treatment for patients with a type of blood cancer called Philadelphia chromosome negative acute lymphoblastic leukemia. First, what is Blincyto? Blincyto is a type of immune therapy, which means it does not kill your cancer cell directly. Rather, it boosts your own immune system to go and attack the cancer cell. From one end, Blincyto attaches to your immune system, or what we call T cells, and from the other end, it attaches to your leukemia cell. And this interaction between those two leads to the destruction of the cancerous cell by your own immune system. There have been two major studies that led to the approval of Blincyto as a consolidation treatment, and I will be discussing those today. The first study was conducted among adult patients who received induction chemotherapy and intensification chemotherapy, and once they achieved remission and their leukemia was not detected, they received either chemotherapy alone or chemotherapy plus Blincyto. And when we followed those patients in time, we found that patients who received the Blincyto lived longer, and at 5 years, 82% of the patients who received the Blincyto were still alive compared to 63% of the patients who received chemotherapy alone. The second study was conducted among a pediatric population and young adults, and it consisted of patients who received chemotherapy for 2 cycles, but the third cycle was either with chemotherapy alone or with Blincyto alone. And again, we followed those patients in time, and we found that at 5 years, 78% of the patients who received the Blincyto were still alive compared to only 41% of the patients who received chemotherapy alone. And let me remind you here of 2 toxicities in particular that we should pay attention to when treating our patient with Blincyto. The first toxicity is cytokine release syndrome, or CRS, which occurs when the immune system is activated and could lead to fever and chills. The second toxicity, what we call the neurotoxicity, or side effects that affect the central nervous system, which leads to headaches, tremors, and sometimes, rarely, it could lead even to seizures. In summary, treatment with Blincyto improved the survival of patients with acute lymphoblastic leukemia. In adult patients, the survival improved by approximately 20%, and in pediatric patients, the survival almost doubled or improved by close to 40%. I hope you enjoyed this video. Don't forget to like and subscribe for more cancer fighting content, and see you on the next one.